So the antibiotic tetracycline, right? Tetracycline are commonly used called tetracycline or doxycycline. The tetracycline or doxycycline. Some books said minocycline, also the example of tetracycline. So tetracycline is a drug of choice in case of urinary tract infection like pyelonephritis or cystitis or any kind of urinary tract infection. The tetracycline are drug of choice. In case of pneumonia, we can also treat it by tetracycline. In any kind of sexual transmitted disease like gonorrhea or any kind of sexual transmitted disease like syphilis, right? We can treat it by tetracycline, right? Also, this gonorrhea or syphilis also be treated by penicillin. So if you ask me, what are the basic difference, sign symptom difference between syphilis and gonorrhea? In case of the gonorrhea, the pus discharge, this is the pus, this is the pus discharge. But in case of syphilis, both are sexually transmitted disease. Organism is different, bacteria is different, underlying cause is different. But in case of gonorrhea, the pus discharge, but in case of syphilis, ulcer developed, painless ulcer, indurated, raise the border. This is the nature of syphilitic ulcer, right? So as I told you, in case of STI or sexual transmitted disease like gonorrhea and syphilis, be treated by tetracycline. Also, we can use or indication of tetracycline any, I said, bacterial infection or any kind of like this acne. Acne treatment also be possible to do by tetracycline. Or Lyme disease. Lyme disease, what it is? Lyme disease are the tick-borne disease caused by bacteria Borrelia burgdorferi. The bacteria name is called Borrelia burgdorferi. The patient is, if they go in some area like, hill area, forest, this type of ticks can bite, and you see the skin rash around, and this is called Lyme disease. So Lyme disease also be treated by tetracycline. Basically, tetracycline, the mode of action, they prevent the protein synthesis and inhibiting bacterial growth, right? So when you give the tetracycline to the patient, you have to educate them about some side effect. So your patient be aware about the side effect. It would be easy for them to adapt, right? Tetracycline sometimes causes GI upset. GI upset. They causes the photosensitivities, right? And also tetracycline can cause the tooth discoloration in the children. So the dental discoloration. Tetracycline also hepatotoxic. means causes the liver damage if the dose is more than normal, and they also can causes the super infection. They also can cause super infection like candida or yeast infection, right? So in case of tetracycline, what we have to know for NCLEX board exam, there are two medication we used as a tetracycline. One is tetracycline, other is doxycycline. So tetracycline do not give to the pregnant woman or children under the 8 years of age. So this is the important note we have to know for NCLEX board exam. Okay, so tetracycline we do not give to the pregnant women or children under 8 years of age. Or if patient take the tetracycline, they has to wear the sun protective glass or sunscreen because they causes photosensitivities and should be taken on an empty stomach. Should be taken without food or empty stomach with full glass of water, and decrease the effectiveness of oral contraceptive. So if any women take the oral contraceptive pill, you have to make sure and you have to tell them the tetracycline reduce the effectiveness of oral contraceptive. Also, the dairy product such as milk or food high in calcium and antacid decrease the absorption of tetracycline. I am going to recap it. So dairy product such as like milk or food high in calcium or antacid decrease the absorption of tetracycline, right? So for NCLEX board, I am again want to review some most important point what is frequently asking about the tetracycline. So tetracycline, as I told, tetracycline can cause nephrotoxicity, they causes hepatotoxicity, they causes phototoxicity. It means they cause renal damage, they cause hepatic damage, or photosensitivity. When we save the tetracycline at home, keep out of direct sunlight, monitor the liver enzyme, and monitor the kidney function, and also lab and urine output we have to monitor. Where if you give the tetracycline to the patient, make sure your patient is not pregnant. So do not give if pregnant or nursing, means if mother is lactating to the baby, do not give it to them, right? Same as aminoglycoside, do not give during the pregnancy, right? Also, do not give with cow milk. Tetracycline with cow milk, do not give. Do not give to the children under 8 years old because they cause teeth or denture to turn black or discoloration. and give this medication with a straw. If the patient need it, better to give them with a straw, and also avoid giving with lasix. So lasix is diuretics, and lasix with tetracycline together is not a good choice. Okay, so this is the most important information about the tetracycline.